And thank you very much for the opportunity to present. I actually want to present a patient. Lymphedema management is not really new. As an old oncology nurse, we managed lymphedema many years ago, but the techniques changed, and I think everybody just became aware of the problem again. Okay, so I would like to present a patient to you, but I think we need to go through the theory part a little so that you can understand, and maybe I can understand, the problem of lymphedema. So lymphedema is a chronic inflammatory lymphostatic disease caused by the body's inability to drain the lymph fluid from the tissues, resulting in the swelling of a body part, most commonly the extremities. Now, it is not only the extremities that swell up, but you will see if we look at the anatomy of the lymph pathways that men and women also can have genital swelling, which is a very big problem. Now, lymphedema occurs when the lymphatic load exceeds the transport capacity of the lymphatic system, and it results in an abnormal accumulation of protein-rich fluid in the interstitium. And it is the protein-rich, that is the protein in the interstitium that actually causes the problem. There are two kinds of lymphedema. The one is the primary one, caused by developmental dysplasia, and secondary lymphedema is caused, which is most common, is caused by factors like surgery, radiation, infection, malignant tumors, immobility, and chronic venous insufficiency. It is not known how many people in the world live with lymphedema, and in 1984, the World Health Organization estimated that 113 million people live with lymphedema, and 20 million of those were women suffering from breast cancer-related lymphedema. In 2006, Foldy and Foldy, and they are the world leaders in lymphedema research, however, estimated that 140 to 250 million people live with lymphedema. Breast cancer-related lymphedema was found to range between 6 and 83%. Okay, and that just gives you an idea of the lymph vessels system. And with cancer, people have a mechanical obstruction usually because they remove the lymph nodes, and so there's just an ordinary mechanical obstruction. Lymphedema, as you know, because of the obstruction or the dysplasia of the vessels, cannot be cured, and it tends to progress without adequate treatment. Lymphedema not only leads to body image disturbances and the accompanying decrease in the quality of life, but also to health-related complications like inflammatory conditions and even malignant tumors. Complete decongestive therapy, also called CDT, is the gold standard treatment for lymphedema, and the main goal of CDT is to return the lymphedema to a stage of latency by using the remaining lymph vessels and other lymphatic pathways. Additional goals are to reduce and remove fibrotic tissue and prevent and eliminate infections. And erysipelas or cellulitis is the most common infection found in people with lymphedema. And CDT has shown an average reduction of the upper extremity of 59.1%. Now, what was the purpose of the study? The purpose of the study was actually to demonstrate and also to raise awareness. So I hope that this case study would be published in the SA Health South Africa, Gesondheid. So the purpose of the study was to demonstrate that breast cancer-related lymphedema can be managed by means of CDT and improve the quality of life of the patient. Now I have to bore you with a theoretical framework because I'm a nurse, and I selected Dorothea Orem's self-care deficit theory because she urges nurses to ask and answer the question of what can be, or first what is and what can be. Also, Dorothea, when you apply this theory in practice, it is characterized by a caring approach where the nurse uses experiential and specialized scientific knowledge to design and produce the art of nursing care. Ethical principles, beneficence, respect for human dignity and justice were applied, and the Tshwane University of Technology's Ethics Committee gave permission, ethical approval for the study. A qualitative instrumental case study design was used as the researcher wished to present the uniqueness of the participant's situation and challenge the perception that nothing can be done for women living with breast cancer-related lymphedema. The patient with the most severe lymphedema that I treated will be presented. And I know you're dying to see the photo, but I'm also dying to show it to you. So mixed methods were used to gather the data, and it included a structured interview, structured observation, and a review of the patient's treatment record, and data were gathered from May to August 2002. That is just for the induction phase of treatment. And just to impress you, validity, reliability, and trustworthiness principles were also followed. The case will be presented using the guidelines of McCarthy and Riley, and I will present the induction treatment to you, and a pseudonym is used. Now, why I chose such a difficult name for an Afrikaans-speaking person to say, I don't know. But it is Bertha. She was 61 years old, and she lived in a township in Tshwane. She was married and the mother of 3 adult children. Bertha was self-employed and was part of the informal business sector. Bertha was diagnosed with breast cancer of the left breast in 2002, and according to Bertha, she was first misdiagnosed and was only diagnosed when the lump in her breast was as big as a fist. And Bertha said to me she could feel this lump moving around. It would go like this, she said. She was scheduled to receive 6 cycles of neoadjuvant chemotherapy, but only received 4, as her fingers and toenails became loose and smelled terrible. After the 4 cycles, a mastectomy, presumably a modified radical mastectomy, was performed, which was followed then by radiotherapy. Bertha was not sure when her left arm started swelling, but reported that her arm started swelling badly 5 years after her breast cancer treatment. And she described the swelling as follows. My arm started swelling little by little. It started swelling up and it would go down, but not everything. And then it swelled again and it would go down, but not completely. And so it went on and on. Slowly, slowly. It was not so.